Good morning to you, good morning to Gisela who supports us from the studios, and good morning to all our audience who tune in every morning. And we are beginning our briefing today reminding our audience, and I say reminding because the story has already been informed, that the 52 health professionals members of the Henry Reeve Brigade first deployed in Lombardy, Italy, they are on their way back home. And these health professionals responded to Italy's call. While deployed there, they worked very hard. This contingent left for the Lombardy region in Italy, which was the region with the highest number of confirmed cases and a high number of deaths, and yet they went there to share their knowledge and experience. There you have some images, and their flight's arrival is expected in the afternoon, and they will be welcomed with satisfaction and pride by our people because of the humanitarian work they have performed. There will be a welcome ceremony at the airport, and this ceremony will be aired on television. And after that, the entourage will depart to the center where they will be quarantined, a customary procedure for everybody who enters the country from abroad. In its route to the center, the motorcade will go through different areas of Havana, and I think you will see on your display the route they will follow. They will arrive at Jose Marti International Airport's Terminal 5, and then they will take the airport speedway. They will go through 114th Street, 51 Avenue, 188 Avenue in La Lisa, going next through 23rd Street, 234th Street up to their destination, La Pradera Health Center, where they will be staying for 15 days in quarantine. Our people is encouraged to show their appreciation from their balconies, their rooftops, and sidewalks to show them the pride we all feel for the good job they have done, with so much altruism and dedication. And they even received an acknowledgement from the Italian authorities for the job they did in Lombardy, which was one of the most COVID-19 stricken regions of Italy. And we welcome our collaborators with the good news that today we continue with our no fatalities streak. This is the 9th day in which we do not report any death due to COVID-19, and this is a reason of satisfaction from the point of view of what can be achieved in terms of the care of our patients. And nonetheless, we are currently keeping 499 patients admitted in our hospitals, 9 under surveillance, 243 suspects, and 247 are confirmed. And in our primary healthcare system, 1,642 are under observation by our doctors, nurses, and technicians. Yesterday, our molecular biology laboratories processed 2,048 samples. In the Pedro Curie Institute of Tropical Medicine, 909. In the Epidemiology and Microbiology Lab of Santiago de Cuba, 288. In the Amenjetas Brothers Hospital, 285. In Havana, 282. In Villa Clara's laboratory, 227. And in the Biotechnology and Genetic Engineering Center, 57 samples. As a result of the study of these 2,048 samples, 9 tested positive for COVID-19, 0.43%. Cuba already accumulates 120,536 samples which have been already analyzed for the detection of the disease, and of them 1.8%, that is 2,200 people, have tested positive in our country for COVID-19. Of the 9 cases confirmed yesterday, all are Cuban. Out of them, 6 are confirmed case contacts, and 89.7% of the cases confirmed in Cuba are contacts of a previously confirmed case, totaling 1,987 people. Yesterday, there were 2 persons whose source of infection was not determined, and now we have 66 people whose source has not been identified, 3%, and the search of their sources continue. One of the 9 cases diagnosed yesterday contracted the disease abroad. It's a person who recently returned to the island. That person was quarantined in one of the isolation centers, underwent the test, and was confirmed as SARS-CoV-2 positive. So 156 of the 2,200 confirmed cases in Cuba, their source of infection has been abroad. This represents 7.2%. Of the 9 cases, 5 are male, accumulating 1,108, that is 50.4% of the cases. 4 cases were female, accumulating 1,092 people, with 49.6%. 66.7% of yesterday's confirmed cases, 6 of them were asymptomatic at the moment of being diagnosed with the disease, and the majority of them were asymptomatic, and this shows the importance of the screening of the population, which, as we have said in other occasions, even if people show no symptoms of the disease, in the cumulative total there are already 1,160 people who were asymptomatic at the moment of the diagnosis, 52.7% of all confirmed cases to date. By age groups, the group of under 40 years with 4 cases, 44.4%, the group of 40 to 60 years, 3 cases, and the group of 62 people were diagnosed yesterday. One 16-year-old boy from Havana was diagnosed, a positive case contact, and in Cuba, 243 children have been diagnosed with the disease, all of them with a satisfactory and favorable evolution. And 87.2%, that is 212 children, have already been discharged and are fully recovered. 8 out of the 9 cases are from Havana province. 1 case, which is a case that got the infection abroad, who returned from abroad and developed the disease here in Cuba while quarantine, is from Holguin province. As you can see, the cases from Havana are distributed in 4 municipalities, and the case from Holguin, and although it was detected there in Holguin, it's clear that his infection was not transmitted in the province. He was already infected when he arrived in the country. So in the positive rate of the country of confirmed cases every 100,000 inhabitants in the last 15 days, Havana province stands in first place with 11.07 rate, followed by Matanzas with 1.81, Artemisa and Ciego de Avila below 1, 0.97 Artemisa and 0.46 Ciego de Avila. And we ratify again that 11 provinces and the special municipality of the Isle of Youth have not had any case of COVID-19 over the last 15 days. And I am referring to Granma, Pinar del Río, Mayabeque, Cienfuegos, Santi Espíritus, Camagüey, Las Tunas, Holguín, Santiago de Cuba, Guantánamo, and the Isle of Youth, which have not reported cases over the last 15 days, as I said earlier. Of the 2,200 patients diagnosed with the disease in Cuba, 247 are still admitted as active cases, and of these cases, 244, that is 98.7%, have a stable clinical course. We always regret the death of 83 people as a result of this disease in our country, and we always convey the condolences to their relatives for a lethality of 3.77% in our country. Cuba was on the 17th place among the countries that make up the region of the Americas in terms of lethality, but now Cuba is on the 18th position. As I said earlier, it has been 9 days since we reported the last death we had in our country. We always mention in our data the 2 patients that were evacuated at the beginning of the pandemic in Cuba, and there were 6 discharges yesterday. We had more admissions than discharges, and as we always say, this is an indicator that is not favorable. With these new 6 discharges, we can say that 85% of the diagnosed cases in Cuba have recovered. Some of them are quarantined at home, and some others are back to their everyday activities. And we report again 3 patients in serious condition. We had the same we had yesterday and the day before yesterday. We have no critical patients. Of the 3 serious patients, 2 are admitted in the Salvador Allende Hospital and 1 in the Pedro Curí Institute of Tropical Medicine Hospital. In the world, as you have also seen, there is a group of countries with high morbidity, a high incidence of the disease, a high lethality, and in the 185 countries that continue reporting COVID-19, the confirmed cases number stands at 6,835,723, with 129,721 diagnosed people yesterday, at a moment that approximately 6 months have elapsed since the beginning of the pandemic, and you see these are staggering numbers that never seem to decrease. And 3,923 people died in the world yesterday due to COVID-19, accumulating 398,635 deaths for a lethality of 5.83%. The region of the Americas, in a no less complicated position, already accumulates 3,280,492 confirmed cases. 73,640 cases were confirmed yesterday. The region cases accounts for 47.99% of the total cases that have been reported in the world. And yesterday, in our region, 2,530 confirmed cases died for a total of 180,803 deaths, and that gives a lethality for the region of the Americas of 5.71%. Of the countries of the world, and especially those from the region of the Americas, which already accumulate some of the highest numbers of confirmed cases, we have the United States of America with 1,920,061 confirmed cases. And as it's also been repeated, it is currently the epicenter of the disease, with the highest number of cases. It is followed by Brazil with 645,771 cases, and Russia with 458,689 confirmed cases. Above all, the United States of America and Brazil have had a growth in number over the last few days, turning them into the epicenter of the pandemic in the world. And this is the national and international information we had for today.